A new report says we collectively understand women's health far less than men's health. That's because just a fraction of research funds to study things like Alzheimer's, heart disease, and autoimmune disease go towards studying women, even though they disproportionately face those diseases. The report is from the group Women's Health Access Matters. It found that a $300 million investment into research focused on women would yield a $13 billion return. It's not just the research field that's grappling with the gender equity, it's also healthcare and the medical workforce. And joining us to talk about these issues and what's being done to address them are Dr. Shikha Jain of the University of Illinois Cancer Center and the founder and president of the nonprofit Women in Medicine. Nicole Wojtowicz, Research Assistant Professor of Medical Social Sciences at Northwestern's Feinberg School of Medicine. Wojtowicz holds a doctorate in biochemistry and molecular biology. And Dr. Vineet Arora, Dean for Medical Education at the University of Chicago Pritzker School of Medicine. Welcome all of you to Chicago tonight. And Nicole Wojtowicz, I'll start with you. Just how overlooked are women when it comes to biomedical research, both as subjects of studies and with data analysis?
Well, first off, thank you so much for having us tonight on this panel. Historically, women and females, and I say females because really this includes our animal models that we use in biomedical research and our cells that are really the first areas where we design and test drugs and therapies. Historically, they've been predominantly male. And so this has really been an issue over the past several decades. And many people don't know that it wasn't until 1993, per an act of Congress, that women were required to be included in National Institutes of Health funded clinical research studies. And then in 2016, the National Institutes of Health also implemented a policy requiring scientists to consider sex as a biological variable in their work. So really, it has only been within the last decade or two that we've seen a push towards inclusion of women and females in biomedical research.
Certainly, relatively recently. And Dr. Vineet Arora, there's a recent example where we just didn't really understand much about women's health issue. And this has to do with COVID-19 and pregnancy. So explain that.
Yes, absolutely. When the COVID-19 vaccine came out, there were no pregnant people or people who were breastfeeding in those trials. And so one thing that resulted from that was this discussion of shared decision-making, because there was really no data to guide the decision-making for predominantly women who were in this position, including myself as a healthcare worker who was breastfeeding at the time, deciding whether to take the vaccine. And while many studies have now since come out highlighting the importance of getting COVID-19 vaccine for people who are pregnant or breastfeeding, as well as the health benefits, that exclusion of that population actually gave a void, and that void was filled with disinformation and misinformation that has actually still led to women, predominantly women, but also pregnant people and people who are breastfeeding from actually avoiding the vaccine, which is very concerning given the health impact of COVID and the severity of COVID on those who are pregnant especially.
There was certainly a lot of confusion in that field for a long time. Dr. Shikha Jain, it's not just research and healthcare that we're talking about here, but also the workforce in healthcare. So how does that need to change to be more inclusive?
That's a great question. And it's so important to remember that these disparities that we're talking about, they directly impact the healthcare workers, because we're seeing women in medicine not being selected for awards or not being selected for promotion or advancement. We're seeing them being overlooked for leadership positions. And there's study after study that has actually shown when you have a more diverse workforce and you have more diverse leadership, you actually see benefits in both the way patients are treated and the overall outcomes of patients. But also you see benefits in the healthcare system where you see increased retention, you see your workers are happy, you see more innovation. So we see huge disparities when it comes to pay, when it comes to promotion, when it comes to publications, when it comes to awards. There's all these disparities that exist within the healthcare workforce. And then the direct impact of that is that we're losing brilliant, accomplished, ambitious women from the health force. They're not accelerating into leadership positions. And then that has a direct impact impact on the institutions as well as the overall healthcare systems and the patients who we're treating.
All right, and Nicole Wojtovich, going back to the research part of it, how does it impact men and women, all people, when women and females are not included in enough biomedical research studies?
So I think this has led to a gap in our understanding of human health and disease. Because so much of our research has been done solely in males, we're lacking information about how sex as a biological variable affects health and disease across body systems. One example that we might not think of is that there was a study that looked at treatment for glioblastoma, which is a type of brain cancer. And just by analyzing the patient data by sex, they found that there were differences in patient responses to treatment in men versus women. And just by asking that question and breaking down the data by sex, they're able to start thinking about, well, how can we tailor treatments that would be more effective for all people?
Dr. Vanita Arora, what if we add in other variables here, women of color in terms of research and quality of healthcare? Are there disparities here too?
Absolutely. There is a wealth of literature highlighting the disparities in U.S. healthcare, particularly with poorer outcomes for those who are from minority groups. We also know that part of that reason is actually our workforce. And so we know that when we admit medical students and residents to our institutions, that those who are from groups that are underrepresented in medicine, or those that are from lower socioeconomic status communities or rural communities, are more likely to go serve those communities. And so this really gets down to a workforce problem, because if you don't actually, much of clinical research is also informed by your personal experience. And so there's been literature showing that there's a huge gap in research as well to study conditions that predominantly affect Black people, likely due to the inadequate funding of really promotion of investigators who are from those underrepresented in medicine groups.
So research and workforce connected here in these problems. Dr. Shikha Jain, we mentioned that you have a nonprofit called Women in Medicine. You organize conferences and training programs. What are the things being done to close these gaps right now?
So there's a lot of amazing organizations around the country that are working to close these gaps. Some of the things that we do in our nonprofit is we have this annual conference that is really leadership training and empowerment of women and also of men, because none of these changes are going to happen without men at the table as well. We've created longitudinal leadership programs to help women become more empowered and learn how to negotiate for themselves. And not only that, but also change the systems within which they work. And we've created leadership programming for men as well, because there's a lot of men who really want to help close the gender gap and want to address these inequities, but they don't always have the tools or the know-how how to do it, because it isn't something that's been taught in medical school education, and it's not something that has been intentionally looked at for a long time. So we're starting to create all of this programming to help people understand not only that the problem exists, but then to empower both men and women to take the reins and create structures that are going to address the barriers that have resulted in this really problematic inequities that exist in healthcare that are impacting people, whether they are in the healthcare workforce or not.
So it impacts everybody. Nicole Wojtovich at the top, we mentioned this study that said that with just a $300 million investment in studying women, you get something like a $13 billion return on investment. Can you explain that for us?
So I think what the issue is that women's health research is underfunded and understudied. And if we make an economic decision to fund research that supports women and other underrepresented groups, it's a trickle-down effect. You will have scientists and other investigators and clinicians be able to apply for grants that support research in these areas. And then once that is integrated into our biomedical enterprise, we will then be able to see the outcomes of that research then translating from the bench to the bedside.
And Dr. Vanita Arora, what about the pay gap? As I read here, there's a huge salary gap still in healthcare between men and women.
Absolutely. And so while we have equal numbers of women and men entering the workforce in healthcare, we do not have equal numbers at the leadership level. And we also suffer a huge pay gap. And so even when trying to control for a variety of different factors, such as number of patients seen or the type of medical practice that you have, we still see about a $20,000 pay gap. And a recent report from the Association of American Medical Colleges clearly outlines that this pay gap has persisted. So we're going to need a lot of solutions, focus on solutions there, like transparency and greater pay equity from the leadership level for institutions to implement.
All right, a lot of issues brought to light here with this report, and we're glad that you're illuminating this for us. Our thanks to Dr. Shika Jain, Nicole Wojtowicz, and Dr. Vanita Arora. Thank you so much.
Thank you.
Thank you.